So for those who are aware about SIENNA deliverables, this work relates to SIENNA reports on state of the art, as well as ethical and legal guidelines, and the legal aspects for human genomics and genetics. So what motivated us to do this code of conduct? One issue was the European Court of Justice has overturned during the summer 2020 has overturned the EU-US Privacy Shield Agreement, and that means most of the data that cannot be sent to the US, whether that patient's data or regular businesses, etc. And especially during a pandemic, that was made things even more complicated to share data about COVID and variants, etc., and patients, etc. So also there was this article in Nature that was calling for an international code of conduct for data sharing in genomics. And they were very specific of what needs to be addressed in that code of conduct. And of literature also discussing the GDPR and how this, the challenges that it poses to sharing of data. And being at CRB, I also was aware of the work that's being done with the Rare Disease Connect, as well as BBMRI. So this made us to choose this as something. Also, we did not want to reinvent the wheel. We did not want to sound redundant. We wanted to discuss something that's needed. And we have adopted a mixed method way to come to, or to create this code of conduct. First of all, we've done our literature to map the needs and the gaps and identify what already is there and build on that. And then when we identify the relevant documents, other legal documents or code of conducts, we have synthesized that to draft a preliminary draft. And then we also identify the kind of questions that needs to be addressed during that code. And with the help of an expert panel that was conducted in September 2020, the expert panel had lawyers, some of them working a lot with GDPR. We had physicians, bioethicists, a sociologist, and a scientist involved. They looked at the preliminary draft and gave feedback, as well as answered those specific questions about certain concerns that were presented in the literature. And lastly, we sent, after making the changes and adopting all the suggestions, we've sent that to be reviewed by SIENNA stakeholders, which included members of professional organizations like European Society of Human Genomics, Global Alliance for Genomics and Health, and Human Genome Organization in Genomics England. This is a slide that shows the documents that we have used to synthesize the code. These are the FAIR guiding principles for data, the RD Connect code of conduct, ethical and legal issues in cloud computing, an international charter for principles for sharing biospecimen and data, the BBMRI ERIC code of data for sharing health as well as data. This is more a global forum for biomedicine research, and they have their own ethics of data sharing and biobanking research. So this is more of a global, and many low and middle income countries were involved in this code of conduct and creating this code of conduct. And then the WHO had this white paper that was presented or left online for feedback. And this was for to advance or enhance the open and timely sharing of pathogenic data sequencing, especially COVID. And then, of course, one of the main documents are the International Code of Conduct for Genomic and Health-related data sharing. So what were the specific issues that needed to be addressed according to the literature? There were concerns regarding identifiability, how to withdraw consent, broad consent, compelled disclosure, and return of individual findings, portability, and access. I would explain a little bit about compelled disclosure because I think it's relevant to many of the ideas of overprotection. Maybe I would just give an idea about how this can be a risk, and that's why some people or some policymakers really try to overprotect. But there are countries like in the US where there is the law enforcement and the NSA, for example, they have the legal right to access data without the person that owns the data knowing. And they can get this through a court and that very quickly, and they can access data anywhere on the world as long as that data is under the auspices or under the governance of a American company. In order to create this code, we also tried to look for criteria for assessing the rationality of regulations. And these criteria were presented by Stefan Eriksson in 2020. So basically, this criteria is how are we phrasing the rules in the code of conduct. So one issue, we made sure that they are comprehensible, so they are easy to understand. The code of conduct has the capacity or decides there are clear indication of where to resolve conflicts if they exist or if they arise, who should do that. And in terms of equality, this code, if two researchers come with the same project, how would they be presented? They would be equally looked at, and the code addresses them equally in front of the law. And of course, effectiveness, and that's basically that the code is fulfilling the objectives it's created for. It has to be acceptable by the users. That's very important. So it makes sense to them. It's practical, and that's practicability and enforceability in terms of there are resources in order to implement the code and to give guidance on the code, as well as, if applicable, enforce the code. Not all codes are enforceable or obligatory. And lastly, we made sure that is smooth and logical, and there are no conflicts between the rules. So we don't present one rule and then 2 or 3 articles later, there's a rule that goes against the first rule, for example. So we try to do that. In terms of scope, it is an ethical and not a legal document. Another is that it's voluntary. It's not a data protection code. And I also know about BMI, ERIC, they are trying to do the GDPR compliant one. It describes best practices and it's compliance and integrity based. And I will be discussing a bit about the principles of the code. And it's relevant for researchers, data controllers, something that we call the Data Management Committee that we propose, and cloud service providers. I don't know if people know about this, but cloud service providers are private companies like Google and Microsoft who provide services, platforms where you can store data, as well as tools to use this data. So these are the principles, and I apologize for the weird looking slide because I try to capture that it's hierarchical. And that the first principle is takes precedence over the second and third, etc. So respect for persons, the first principle, beneficence and non-maleficence, protect and respect vulnerable populations, freedom of scientific inquiry, transparency, accountability, fair share of benefits, community protection and engagement, attribution of work, as well as data minimization. And by that, we mean that only the data should be collected for the purpose it's supposed to be collected for. We try to cover what is defined as data cycle. So basically from the patient or the data donor giving their data until they get findings or get relevant information for them if they ask for it. And we propose what is known as a data management committee. And this data management committee is in charge of creating a governance system. And in a way, this governance system manages the data collection, data storage, data sharing, transfer and access, and when there are incidents of compelled disclosures or data breaches. We also provided provisions for data handling in low and middle income countries, as well as community engagement. Of course, we have limitations due to time limitations as well as resource limitations. We could not make this data protection code. There was very little input from stakeholders like researchers and data subjects. Their input lacks, like we could not get their feedback on such a code, as well as inadequate input from low and middle income countries. And I think that's it. So my presentation is, I would like also just to acknowledge member of the expert panels, SIENNA stakeholders, communication team, and SIENNA partners. And this has not been approved by the European Commission yet. So that's all. Thank you.